So the Carer Peer Mentor programme started off from a team in East Ayrshire Council called Thinking Differently. They'd started off with peer mentors within the council, and they took the opportunity of the upcoming Carers Act in Scotland to start a team of carers working in the with groups of working to get the opinions of carers on the work that they were doing with the Carers Act. So things like the strategy and also adult carer support plans. So that's how we came about. They picked 7 of us along with the East Ayrshire Carers Centre, and we've been working with them now to implement the Act.
This approach.
So I think from the very beginning, it was clear to see that the Thinking Differently team really wanted carers to be at the heart of the consultation, but also the implementation of the Act. They felt that it was best for carers to have their say, and not just someone behind a desk in a council office. So they decided to employ 7 different carer peer mentors, and they gave them the opportunity to go out into the public, into the community, and sort of gain access and sort of see what kind of carer-led groups would like to be involved in the sort of implementation. And I think that allowed the carer peer mentors to have an empathetic and sort of compassionate approach to the Act. And I think that in itself was an advantage, as it sort of led carers to feel a bit more at ease and be able to open up about their caring role specifically and how they felt the Act could be shaped to help them. So it was definitely a very forward thinking and unique approach that we certainly felt privileged to be involved in.
So in practice, what we've been doing is we've been going out to the groups, we've been contacting their leaders and explaining to them about the Carers Act if they didn't know about it already, and asking them if they would like their group to have a say on what was going to happen and to be able to influence what happens in East Ayrshire and the level of service that happens here, and how their carers are interacted with by social work. And we've then proceeded to go out to those groups. We've brought with us little leaflets that give questionnaires about what they consider to be a break, what their main barriers to breaks are, these kind of questions. We've also used our newsletters here at East Ayrshire Carers Centre as a way to gather information. We have around 8,000 registered carers here that receive these newsletters. So we had a wide variety of people that obviously could respond to that. We've also went out to groups and teams within East Ayrshire Council in order to present the Carers Act to them and keep them up to date with what's been going on and what their responsibilities will be as the Act is brought into law.
That's great.
So I think first of all, challenges in terms of implementation, just getting out to the community-led groups. I suppose the sort of the jargon that's been used and associated with the Carers Act has been difficult for us in terms of accessing the groups. We would find that various different carer-led groups, they wouldn't understand what we were trying to achieve. We maybe felt in a way that they felt that we were coming along to maybe steal their clients away and start up something new, a new group, that sort of thing. Firstly, I think a challenge was just getting through the door and letting people know about the Act itself. And I think secondly, being a carer was a bit of a struggle for us as well. We first of all started with 7 carer peer mentors and we're down to 2. And again, I think various different caring roles and some were more in depth than others. Some of the peer mentors just weren't able to sort of participate as much as what they would have liked, and unfortunately had to step down from the role. it definitely was a challenge for me and Cameron as well. We had to take on a sort of higher workload, if you like. But again, that gave us a lot more hours to sit down and think things through and learn as well. Because for us, it's new as carers. But again, it's allowed us to sort of approach other carers and feel a bit more confident and at ease with each other. So it's opened up the door for people to talk a little bit more than what they would have if it was maybe a social work department employee or whatever.
So far, because of the questionnaires we've been doing and the feedback we've been getting, we've had a very good influence on the adult care support plans for East Ayrshire, which are now fully implemented. They're now being used by ourselves here at the East Ayrshire Carers Centre and by social work as well, I believe. And as a result of these, we've been able to have carers that come into our service for one thing that they've heard that we do, and we've been able to tell them, well, as a result of your carer support plan we've seen, we can actually support you here, we can give you respite, we can try and arrange for adaptations in your home. We've been able to pick up on these things a lot easier than we did before with paperwork that we were using before. So that's had a good result from that, even at this early stage after the implementation of the Act. Part of our job as well as care peer mentors, we've been able to work on things like the short break statement with the council. They've seemed to have been quite receptive of the version that we've been working on.
For me, definitely a bit more about how services are sort of provided in East Ayrshire, especially in terms of the likes of self-directed support. I think that was a big sort of minefield for us, and it was really beneficial to sit down and find out how it is implemented in East Ayrshire and how people are eligible, what sort of criteria is met, and how people are sort of able to access a budget. And I think a lot of the self-directed support process has been carried forward for the Carers Act, which I think is a good thing. So I think we've been able to improve on the current process for sort of self-directed support and sort of tweak it and change it to fit the Carers Act. I think that was definitely a big learning curve for us, but also in terms of speaking to carers and sitting down and just having a chat with them. It was eye opening. Some of the experiences, the situations that we've been able to hear about, but also be able to say, well, this is what the Carers Act's for. It's to try and better support you in your role.
Just the initial kind of learning about the Carers Act itself before we were asked to become carers peer mentors. I hadn't really heard anything about it before then. So being able to get all that information and also speak to members of staff in the council that had read through the legislation and were well versed on what it meant for them was quite an eye opener for me as well. Also to hear that there was people within the council that had a desire to hear from just regular folks, that they would be able to have a part in this, and that they cared about what carers thought was eye-opening to me. I had not been part of any kind of consultation event or anything like that before, so it was all new to me. It's also been good to be able to make the contacts within the council that are able to support us in passing on information to carers about other things like the SDS and smart supports. It's been very valuable for us to be able to get in contact with these people when we need them and get that expert view from them as well. So we've gained quite a lot from this, as well as a carers centre,
Mhm.
as well as peer mentors.
Mhm. So I guess the key to how this works is you guys need to be supported in your role.
Definitely, I think. I mean, we've had multiple meetings before we got sort of cracking with the work, and we were able to sort of learn. First of all, before we were able to go out into the community and find out the views of other carers. I think those initial meetings were really confusing for us, so it did take a little bit longer for us to get a hang of things. But it's allowed us to become sort of more able to go out into the community and speak to people and provide the information that they really need to know. But as well as that, be able to gather up the information that's required to sort of shape the Carers Act for carers.
Thank you so much for giving me your time to tell us about the carers implementation here in East Ayrshire.